Okay, well, I'll start the introductions and people can keep rolling in. I'm really, really excited for today's seminar, and I was really hoping that I'd be able to meet you guys in person. I just want to remind everybody that this is seminar does count for continuing medical education credit for those that's relevant for. And if you want to receive CME credit, please, everyone, please record your attendance at the seminar, but it's required for the continuing medical education or CME credit that you fill out this, use the QR code. And then at the end of the seminar today, there'll be an evaluation form, and you need this code, which is exploits, and I'll put it in the chat as well. So today it's my pleasure to introduce our nursing informatics colleagues. All of our presenters are secondary faculty members of DBMI, and their primary academic homes are in the CU College of Nursing. All of our speakers have earned PhDs in their respective fields of study, and several are board certified in nursing informatics. And today we have the pleasure of hearing about each of these faculty members' current research, teaching, and other activities that promote nursing informatics, with the goal that we recognize that there's much far beyond just our primary faculty in our department, and there may be opportunities for collaboration. So please joining me, and I put these in alphabetical order. Dr. Christina Baker, Dr. Daywan Bake, and I'm so sorry if I said that incorrectly. Dr. Sharon Giarizzo Wilson, Dr. Mustafa Azkenak, Dr.
That's
Samantha, how do I say it?
that's good. That's good. Oscar.
Azkenak, and Dr. Samantha Stonebreaker. And I apologize if I did not get many of those names correctly. So we'll give a warm welcome and then you guys can get started. Thank you so much for joining us.
Well, I have to say, you said my name correctly, so that's a big kudos. As long as you don't get the Z's in front of the R's, I'm a happy camper. All right. So I am Sharon Giarizzo Wilson. I happen to be the director of the healthcare informatics program over at the College of Nursing. I won't go into a whole lot of detail on my background because I've been around the block a few hundred times. And that's one reason why I was recruited. So, and I'm going to provide a little overview of actually the program, just to give you some idea of what we're doing in the college and where we want to go to. So this program, it was one of the first informatics programs in nursing for the entire country. And the individual that they brought in, Diane Skiba, was not a nurse, but she had informatics background, and she was recruited to create a nursing informatics program because it was just starting to emerge within this as a specialty. So in 1997 was when the program actually got launched. But for our students, we tell them, here's some information that gives you a little bit of a background on how forward-thinking CU was actually when they decided to do this program. So in 1992 is when the American Nurses Association first recognized the specialty. And then in 1995 was when the association, so the ANA, in case you don't know, they are the global association for all nurses that practice within the United States, though we have some international activity also. But they created standards in 1995, and those take about 2 to 3 years to create, which just means that CU, who was creating their program, had already started working on it before these standards had emerged. Now, in 1999, the Technology Informatics Guiding Education Reform was a nursing group of informatics pioneers that got together and said, nurses and hospitals need to understand informatics principles. So they created some standards around that. And then the ARA High Tech Initiative that came up in 2009, the government provided a lot of stimulus money to allow hospitals and physician clinics to adopt electronic health records. We're currently at about 98% on hospitals adopting electronic health records and about 78% of physician clinics. And the reason there's some, let's say, a little bit of delay in that is because not all physicians were had access to funds that the government provided. So some specialty groups like psychology, pain docs, or some of the less well-known specialties were not allowed to access that money. And the other piece that really stimulated this program was the advent of digital health. So digital health, as you know, is very integrated in everything that we do, not only in healthcare, but personal lives. And with that, we've got AI, which is another indicator that we're going to be changing what we do in informatics, not only in education, but in every avenue of life that we know in the United States and internationally. So with our informatics program, what's unique about it is it's completely asynchronous. There are some informatics programs that are face-to-face, there are some that are hybrid, but our program was specifically created to be asynchronous so that we could get students in all walks of life working full-time and could complete their coursework whenever they were available. Now, the program itself, the master's program, is only for nurses, but we also offer a certificate. So the certificate students take a subset of the informatics MS program, and it's also asynchronous for them. Sometimes we do have guest speakers. Periodically, we have a faculty member who wants to do a live session with the students, but we record it. So if students can't make that meeting, then they can watch it at a later point. We also interact not only with the faculty that are on campus, but internationally. And that's where we tend to get some of our guest speakers. So they might be individuals who are in industry, they might be at national level, they might be at a different university, and they come and they provide perspective that we may not have here on the university, but also additional knowledge. So for example, I mentioned AI. This program didn't have a lot of AI in it at all. And matter of fact, didn't have any when I started 4 years ago. And we're just starting to bring it in. Now, our faculty that teach may be working with the AI technologies, but of course, proper did not have that. So we bring in guest speakers to cover those gaps. We also have our students attend national conferences. So a student gets a free membership to HIMSS, the Healthcare Information Management Systems Society. Do you know about that? Oh, you need to know about HIMSS. HIMSS is a national organization that includes anybody and everybody who works in informatics. So it can be practitioners, it can be students, it can be computer scientists, it can be government individuals, it can be startups. That is a great place to expand your network on different informatics applications and also collaboration. So the folks that are at HIMSS, you start building your network, and you might think that it's, a pretty big organization. Their conference draws about 35,000 people a year. I'd say that's not small change. But our community is small compared to other communities within healthcare, other communities within the informatics space. So it's good to start your network regardless of where it is. There's other organizations. One is the American Medical Informatics Association. That is more of our academic and research arm. You may know about AMIA more so than HIMSS. But I encourage you, if you're doing research, if you're doing innovation, connect with AMIA also. Both organizations overlap, but they're very distinct in their approaches on what they do within that space. So I talked about building the network, but our students also get a lot of hands-on informatics work, not only in each of the courses that we provide, but they have a practicum, which I'll talk a little bit about also, because that allows them to pull everything that they've learned together and also learn new information and new skills, depending on wherever they're placed for the practicum. So I talked a little bit about the collaboration, but our partnerships are very broad. For example, because we're at the Anschutz campus and we have informatics, we needed to consider other campus offerings to see how we could grow the program. So the Boulder Leeds Business School reached out to us. They wanted to create a business track for healthcare analytics. These are students who have no clue of healthcare, do not understand informatics. They know business and they know analytics, but they want this healthcare analytics specialization. So they come to our college and they take 2 of our primary courses. So to introduce them to what healthcare is, importantly, what informatics is, and most importantly, who are the players within the healthcare space. And I love it because I like disruption. And they come in with a completely different perspective. And most of our students in the College of Nursing are NP students. And they really don't like talking to analysts, much less dealing with the finance. They want to just take care of the patient. So these students come in and they ask a lot of questions. And then I tell the students to take the courses, ask questions of the other clinicians that are in the program so you can understand what they need. I also talk about guest faculty. Guest faculty are huge. I have drawn from people that are industry. I've got a couple of people that come in and speak from the CU Denver campus, from the computer science. We look for individuals who have specialization. My goal for this course and also my secondary appointment is to create a better partnership and more collaboration with the Department of Bioinformatics, because you have a great source of information that can be shared to these informatics students who, by the way, are clinicians. They're nurses first, and they're learning about informatics, but they also need to understand how the specialty of informatics is expanding, where it's changing. What you're involved in will impact what they do on a daily basis within practice. And then our community affiliations. These are some of the different organizations that we work with for our placement for our students in the practicum. We've had collaborations with Contexture, which is a health information exchange organization, professional associations where students go in and they work with terminologies or they work on projects to help to move that professional association forward. We've had individuals that actually got a placement at NIH in Maryland within their hospital, working with their informatics team. So my goal, primarily with the community affiliations, is to move our patients, our students out of the hospital environment. Informatics is not just in a hospital. It is broader because our patients move. And this includes looking at the startups that are out there. So if you have some great ideas, knock on my door. I would entertain a conversation with you, and you might get recruited to do a guest presentation too while you're at it. So the MS program itself, we have some core courses that all graduate nurses have to take. They have to take Berry. They've had this in their undergraduate, but this is the more advanced level. They also have to take evidence-based practice, which is another level up from what they had in their undergraduate. Policy and politics of health is huge in informatics. Everything we do is driven by the federal government of the United States of America. And I say it like that because I got to work with them. And you know when they say the right hand doesn't talk to the left hand, I got a first-hand experience with that. It was truly amazing. But policy and politics is also critical because when you're at the clinical level, you see what the issues are. And you really need to start voicing what you see and what needs to change. It might be at a local level, it might be at a state level, it could be at a federal level. And if it's at a federal level, it's because you're engaging with those specialty organizations. The HIMSS and the ANIA of the informatics world have work groups that you get involved in, and your voice is important to create the agendas that they bring to the legislators at the government. Our informatic core courses, these are the key principles that the students need to understand to move into the specialization. So decision support and database management, how is that used within a clinical environment? Semantic representation, that's all the coding languages that, well, I shouldn't say all, a subset of the coding languages that we use that drives all digital applications. The information technology system lifecycle, I call this the bread and butter of informatics. It's essentially a project management, but it talks about what do you need to think about when you're just starting to consider an implementation of a digital device? And then how do you maintain it? How do you evaluate it? And then eventually it sunset because another product is coming in. And then the advanced informatics practicum, which I'll talk a little bit more about. So our students also have an opportunity to pick 2 electives. And the electives complement the areas that they're most interested in. So database management, they actually get some experience on building databases. Digital tools for connected health talks about all those ethical and user applications on what is a digital tool, what do you need to consider when you're building it, and how is it evaluated once it's created. Knowledge management talks about, obviously, knowledge, but what is actually knowledge management when you're working with technology within an organization? There's that institutional knowledge, which is critical. You need to save it because if someone leaves, you don't want to leave a giant gap. So how do they procure that? How do they maintain it? Importantly, how do they share the data? Now, the human-computer interaction design principles, that's the usability course. And it talks about all of those features that you really need to be sensitive about. It's not good enough to build something. How is the end user going to use it? And if you intend for it to be more broadly adopted, does it work for everybody? So you probably know in AI, there's all of these biases that are built inherently in the traditional models and even some of the generative AI. That's because people are in the traditional models, it was usually the white male who created things, so it wasn't appropriate for females. So do you think about facial recognition? So not only females, but international individuals that have different facial structures weren't recognized. Some of the models were tested efficiently. So when they had a model that could identify a dog, it might have identified a furry cat or maybe a hedgehog, who knows? But these biases are some of the things that you need to think about when you're using any of the devices. So that's the human-computer design principles. Now, the next 3 are from our partnership with the Leeds Boulder School of Business. Students can take these 3 courses. There's a summer workshop which doesn't have credit. So really the 2 credit courses are the Survey of Business Analytics and Machine Learning in Python. Those 3 courses are part of a certificate that students can take. And the way the certificate is built, they can take these 3 courses, take 1 additional course, and they have a certificate because one of the requirements in the certificate is one of the core courses in the informatics program. Alternately, students have the flexibility to say, I don't want to carry that informatics course in, I want something else, and they can pick up another elective. So our practicum experience, our students have a 270-hour practicum, meaning they actually work with an organization and a preceptor over a 270-hour period. That is soon going to change to 500 hours in the next couple of years because of our education standards are changing. They can have either an in-person or virtual experience. Most people do a hybrid experience, meaning they might come in a couple days or maybe a couple of hours a week, and then they have a project that they're completing on their own with the backup of their preceptor. The practicums are project focused, as I mentioned, to help them solidify all the skills and knowledge that they've learned. And remember I said they have to have a theory course? This is where they use it. Informatics uses theories. There's multiple theories that we have seen students pick for their practicum, but I know organizations either have a nursing theory that they use, but undoubtedly the informatics program has their own theory. And in using that theory, it helps guide their work within the project. And sometimes new theories evolve and the organizations are encouraged to publish that information because it may be usable by another organization. And then lastly, yes, they have a comprehensive exam, not a traditional one where you have finger to keyboard or pen to paper. This is a slide presentation to a group of faculty, a small group of faculty, and they're presenting the project that they've done. And they have to identify the theory that they use. They also have to demonstrate how the project, the presentation that they're doing, utilize the courses that they knew. So what we're having them do is think really systematically and deeply into what their courses provided for them. And during their practicum, they also get coaching about thinking about what they learned and how that actually changed how they approached a particular situation. And then also research. So a lot of the informatics students do quite a bit of research. It's not formal research unless they're working with a research team, but they have to synthesize information. So they've got to dig into the research in order to understand what is needed to inform the project that they're on. And with that, we're going to talk about Christina Baker, who unfortunately had a family emergency and couldn't join us. So we're tag teaming this. So hang on, it's going to be a wild ride.
Because we didn't want to leave Christina out because she's such an important part of our faculty and of this presentation. So we didn't want to just delete her slide. So we're presenting Christina.
Yeah, just switch the,
So Christina did her Bachelor's of Science at University of California. She did her BSN at San Diego, and then she did her master's and PhD here. She also holds a few certificates. And Christina's very excited about her clinical experience, which she brings a lot to the table in that sense.
So her background is primarily in pediatrics, but she also has a background in school health nursing. So being elementary and high school, and you know, when you're sick, you go see the nurse, whether you like them or not, they tell you what you need to do and you may or may not listen to them. So that's her background. So she did work with the Denver Public Schools and also at Children's Hospital, Colorado, even though she was being a school nurse at that point. When she was at Children's, she worked within a school nurse role because she worked with the long-term children who are hospitalized over at the hospital so that they would not lose a lot of or fall too far behind, I should say, in their academic education. She's currently an assistant professor. I was thrilled to have her join our faculty because between the two of us, we bounce off a lot of information on what the program needs or where it needs to go.
And she teaches in the informatics program, obviously, the graduate level courses. And Christine is also really active in AMIA. And within AMIA, there's the Nursing Informatics Working Group, which a few of us are really involved in. And so she put these slides up just to highlight how important it is the nursing role can be in these national organizations. And including, she's in the NIWIC policy group. who's working on investigating state policies focused on legal aspects of AI in nursing.
So NIWIC is the Nursing Informatics Working Group. So that's just one of many work groups that they have. And her research interest, being a student nurse, school nurse, she has a passion, and I say has because it's still a passion for her. Is this one of her?
Let's go to the next one because this is kind of like her previous.
Okay, so thank you. So her passion is making sure that the data that the school nurses have about a patient, so meaning the student, is available in the electronic health record of either the physician or the hospital, and vice versa. So school nurses have a really tough job. They have students who have diverse disabilities and healthcare needs. So they need to check up on these students. They need to make sure they have their medical treatments during the school day, and also make the decisions for a treatment plan for the next day or later in the day, so that parents have the information they need. But that data is stonewalled. You know about FERPA, which is the academic environment equivalent of HIPAA, which is the Healthcare Insurance Portability Act. But what it essentially says is HIPAA, you can't share information to people who shouldn't have it. And if you do, you get your patty cakes slapped really hard. Same thing with FERPA in a school environment, thinking elementary and high school. But school nurses have a legal ability, and HIPAA allows us, have a legal ability to see the data that the student has in their medical record, their history, their treatments, who the docs are. But because of the disconnect and the ability or the inability to share that data across the school and the hospital, there's a big perception that school nurses shouldn't have that information. They don't need to know about the medical illness of the student or the medical treatments or what's failed in the past. So Christina, God love her, she's passionate about this, and she wants to build the bridges. She wants to create the interoperability of allowing that school data to go to the hospital or the physician office and vice versa, so that there is open collaboration and communication about these students who are a very specialized population of patients that a lot of hospital people don't think about unless the student comes into the emergency room. So she's done a co-pilot, and she's working with the Quality Health Network, which is on the western slope of Colorado. And she also works with Contexture, which is it's a for-profit healthcare information exchange that's supported by the United States government. And she's, for her pilot, she's working with the school nurses that are in the Delta area of Colorado. And she also has a couple connections nationally about what's being done, because her next steps are to, after she does a survey and she interviews and she finds the results on what they found in the Delta area, she wants to expand this nationally and get other school nurse organizations involved in what they're doing. And that's her work in a nutshell. Okay, Dwan, you're on, and I'll quit talking.
Hey everyone, I'm Helen Beck. I'm an assistant professor in the College of Nursing. I'm so happy to present my teaching and research experience in this group. I'm talking about digital health in older adults today. My program of research is to develop high-quality, technology-based behavioral health interventions to improve self-care management and quality of life or community dwelling or the adults with chronic disease and their older family care partners. I have 3 focus areas in digital health research. First one is about ML's application for self-care management and symptom communication. During my postdoc funded by NIH T32 at Columbia University, I participated in development and testing of MS applications for persons with chronic disease. So I have during the postdoc, I have gained expertise in human-computer interactions, participatory design method, and usability testing, and mixed methods and visualization. Based on my expertise and the findings from my K-work, which I present later, I developed a low fidelity prototype of MS application to support social connectedness among older family care partners. In the submission of our 21 grant in June, I will aim to define and test an enhanced application. And my second area is about digital health physical activity program funded by NIA K Award. In this paper, in this research, I'm developing and testing digital health physical activity program, which called TPA4U, to support health and wellness among older family care partners with persons with heart failure. Specifically, aim 1 is to develop the TPA4U innovation by evaluating its technology features. We use the simulation-based approach, and aim 2 is to conduct field testing of TPA4U to optimize reachability and acceptability. This is 2 phases iterative process. Based on the feedback in phase 1, we modify the features, technology features in phase 2. Actually, I'm currently conducting aim 3, which is pilot ICT to assess feasibility and preliminary effects of the innovation. So actually, I wanna explain a little bit about 12 weeks TPA4U program in the pilot RCT study. The TPA4U integrated 3 technology components, including video conferencing, Zoom, physical activity session with a health coach, and daily activity monitoring with the wearable sensor data, which is Fitbit, and motivational text messages. The participants' physical activity goals and needs and feedback and their physical activity sensor data are identified and addressed to tailor the physical activity sessions. And then based on the integrated data, the health coach create a tailored physical activity session by Zoom and deliver the sessions. PI and health coach provided motivation text messages based on participants' subjective and objective data. For the subjective data, we identify participants' barriers to physical activity and then send them a tailored message to address the physical activity barriers. The expected outcomes are increase their physical activity counts and function, sleep quality, and caregiving, self-efficacy, and quality of life, and also decrease sedentary time, depression, anxiety, stress. I'm gonna go back to the slide. The third area is about AI-powered automated assessment development. Now I'm expanding my research by developing AI-powered algorithms in collaboration with experts in computer science and engineer program. So I submitted this application to a 2 pilot grant funded by Penn AI Tech. In this grant, I want to develop AI-powered automated caregiver burden assessment using NLP, including large language model, for early detection and providing timely interventions. Specifically, the aim one is to identify patterns of caregiver burdens from participants' daily digital diary using NLP-based topic modeling. And aim two is to develop a large language model based predictive models to detect levels of their caregiver burden using supervised classification. So regarding my teaching and supervising experience related to informatics, I'm teaching a master's program, which is Foundation for Healthcare Informatics. And also I'm serving as a committee member for comprehensive exam for master's students. And also I'm serving as a professional organization, which is AMIA, Nursing Informatics Working Group. Thank you for your attention. Feel free to reach out to me if you have any questions. Thank you so much.
Thank you. My name is Mustafa Özkaynak. I'm one of the faculty in College of Nursing. I'm one of the faculty, non-nurse faculty in the college. In fact, in College of Nursing, we recruit several non-nurses and mostly research purposes. So then also my emphasis in the college is research. And then if any of you considers working in a faculty as a College of Nursing, I highly recommend. It's a great place to work, and we can definitely chat about it. So my background is in industrial systems engineering, and again, most of my work is related to research, and my main research area, like the central theme of my research is really workflow, and I develop methodologies to capture, analyze, and visualize and interpret workflows. And mainly I study workflows in order to inform, design, implement, and evaluation of clinical decision support systems. So I put clinical in parentheses because sometimes some decision support systems in healthcare, they're not really necessarily clinical, and so I use it in more broader terms. And then these are some of other terms that came up in my publications or in proposals. So my most current research, actually, and the one is also part of it, is called implementing decision support in long-term care. Long-term care is an umbrella term for nursing homes and assisted living facilities. And then this study, again, we very recently started, has 3 main aims. And then here what we do is, first we like to characterize long-term care context and what does work look like in long-term care, and then identify some implementation requirements for effective decision support technologies. And then so the first aim involves a lot of field studies. We will go there, we will conduct observations, we will do interviews, and we will also ask staff members to carry some RFID tags so that we can look at for multiple months where they spend time in the long-term care facility. So, and just like many other colleagues, I also use qualitative and quantitative data together in many research studies. And then we also implement in evaluate two decision support prototypes for long-term care. And one of the technology is gonna predict falls of residents. And then the other one, we are gonna predict burnout risk for staff members. And then burnout is a big deal in healthcare. It's a huge public health risk. And then it is even worse in long-term care facilities. And then after making sure we understand the context, we implement technology, and then we will also track adaptations into decision in study settings, and three actually. We are going to implement this in 3 different facilities, and we are going to look at how they change the technology, how they use technology differently, and then how they change work environment to better fit for technology. So another project, so this project we are wrapping up. So it's about developing clinical decision support systems adaptive to clinicians' fatigue. So that we work with Children's Hospital for this study. And then the purpose here is to understand the impact of occupational fatigue on clinicians' decision-making, clinical decision-making, and also the impact of fatigue on the way how they use computers in clinical settings. So that we want to make sure when we develop technologies, actually it's developed the way that it's going to accommodate clinicians' fatigue, which happens frequently. And the second aim is to develop evaluation and the design guidelines for this type of clinical decision support systems so that they accommodate clinicians' fatigue. So another study I'd like to talk here is that it was about developing some smart glass. So when I say smart glass, it is more like a Google Glass type of application. So it's a glass with a camera here so that the user on the field can communicate image, video stream to the expert outside. And in this case, we wanted to use smart glasses by EMS personnel on the field, like ambulance personnel, so that they can better show patient to the doc, ED doc, in the incoming hospital, so that so it supports coordination and then improve better intervention on the field. And then also the clinicians can get better prepared in the emergency departments for the incoming patients. So the last study I like to highlight. So I picked studies to show like the different type of work our group has been doing. So it's about promoting the health of refugee children. So what helps and hinders the adherence to prevention and treatment advice. So that the idea here is that to understand some unique challenges and the facilitators faced by the refugee populations, particularly to take care of their kids. And actually now we are working on an R01 application to build on this study. And then once based on this pilot study, we found out that the one challenge they have, their navigation, like the US health system is complex for everyone, and about the refugee population, they have some unique challenges. And then we are actually thinking about developing some interactive novels to better teach, to improve navigation skills of refugee patients. So that's all I have from me. Thank you.
So hi, I'm Sam Stonebreaker. I'm the last presenter in our team of presenters. I'm going to go kind of quick so that we can be sure to have enough time for questions. But I'm also a researcher, mainly in the college. And then my program of research really focuses on mHealth for HIV treatment and prevention, especially amongst marginalized populations. So I'm going to just kind of skip over this, but similar to everybody else, I teach in the informatics program. And then I also am in AMIA's NIWIG. I am on the digital communication committee right now and the editorial board of the JAMIA, their journal. And so to jump in, I talked about this project a little bit when I was here, or actually in depth when I was here in the fall. So I just want to quickly touch on it. This is my main project. in which I developed a mobile app, InfoVis for Health, which is a bilingual Smart on Fire app that aims to improve HIV-related health communication through evidence-based infographics. So basically, you have this app that's at the point of care, so a provider who's providing HIV-related education can pull up this set of infographics to help them communicate complex information in a really simple way. And I've done, so the K99 phase of this award, I did 2 pilot tests, one in New York City and one in La Romana in the Dominican Republic. And then in the R00 phase, which I just finished up, we did an RCT of this intervention in Denver, Colorado, and also in La Romana, Dominican Republic. And so those are some exciting results. I'm excited to share in another presentation, but I put that into an R01. And so it was just scored in the fall. So I'm excited to do a resubmission for coming up this May. The aims of that are, we need to expand the infographic database that's in InfoVis for Health, because right now it's just started with a few images that I made during my postdoc a long time ago. So we're ready to expand that, because I think it'll be much more relevant to people who are going to provide this type of education, that there's just a much more comprehensive database of images. Then for the second aim, we're going to create AI models to select appropriate infographics based on EHR data, especially the social determinants of health. So that obviously using some of my colleagues who have more AI specialty than I do, that we're going to create this so that it makes it easier for physicians not have to or nurse practitioners or whoever else is doing patient education, not have to flip through this huge database of images, but somehow have it pull up the images that would be the most relevant. Then we're going to actually integrate the app into the Epic EHRs at 2 clinical sites. And I can do a whole other presentation on why that aim is so hard, but theoretically we're going to get in and be able to actually put our app into the Epic EHR systems. Everybody cross your fingers for me. And then we're going to do a multi-site RCT with those 2 clinical sites to evaluate the ability of InfoVis for Health to improve HIV-related communication and health outcomes. And then 2 of the other studies that I want to highlight are, I'm working on an R21 that's called VaxCom, and we are working to design, develop, and conduct usability testing of a mobile app that's going to be used by recruiters in the field to recruit transgender women into phase 1 HIV vaccine trials. I think this is a really important app. Those turns out transgender women are really underrepresented in HIV vaccine trials, and they're maybe the population that stands to benefit the most from an HIV vaccine if there is one that's actually approved at some point. So being able to get those women into those trials, I think, is hugely important. And for that, we're using participatory design methods to make sure that the app that we're creating is useful for both the recruiters as well as the transgender women that they're aiming at recruiting. And then in my R34, I'm MPI on both of these last studies. We are designing, developing, conducting usability testing, so similar to the other one, of a digital tool to facilitate shared decision-making between transgender women and their healthcare providers regarding conversations about PrEP, to help transgender women then pick the appropriate PrEP method for them. And using similar methods with participatory design with all of these different stakeholder groups, we're aiming to develop this tool that's going to be sensitive and meaningful to all of these different groups that have been using it. And then at the end of this, we're doing a preliminary pilot with a small RCT. Those are my studies. And we're just really glad that we had the opportunity to present here today. So we want to have time for questions. We're all looking for more collaboration and people who want to participate in any of the teaching that we do at the college, do guest lectures. So we're just excited to meet everybody, because a lot of us are a little bit newer in the secondary faculty role. So thank you for having us.